Hey everyone, it's Dr. Bowen. I'm a board-certified physiatrist here at Jersey Regenerative Institute, or NJRI. For the past few weeks, I've been making videos on the knee, because it's the main thing I'm treating here at NJRI. So I'm on a journey to educate the public about the knee anatomy and injuries that people sustain. That way you can understand what's causing your pain, and you can seek the correct medical help. Here at NJRI, we release your intrinsic ability to heal. So click through the channel to see the previous episodes we've had on the knee series. Today I'm going to go through the extensor mechanism of the knee. That's the front part of the knee. So feel free to leave a comment below telling us what you'd like to hear more about in our future video. If you like what we've been putting out so far on YouTube, throw us a like and a subscribe on our channel. Click the bell notification so you don't miss anything. It costs you nothing, helps us out a lot, and we really like to hear from you. So okay, let's start to get into this. The extensor mechanism refers to the complex anatomy responsible for extending the knee joint. It involves several structures that work together to allow for straightening of the knee and to support weight-bearing activities. This mechanism consists of the quadriceps muscle group, quadriceps tendon, patella, patellar retinaculum, patellar ligament or tendon, as most people know it, the pes anserine, and the adjacent soft tissues. Injuries to the extensor mechanism are common and consist of chronic degenerative injuries, overuse injuries, and acute trauma. The extensor mechanism of the knee begins at the hip, so let's do a quick overview of all the different things that are involved in the extensor mechanism. First, the quadriceps muscle group. This is a group of 4 muscles located on the front of the thigh. The quadriceps muscles include the rectus femoris, and the vastus lateralis on the outside, and the vastus medialis on the inside, as well as the intermedialis. Then there's the quadriceps tendon. This tendon connects all the quadriceps muscles together to the kneecap or the patella. It's a thick, strong tendon essential for transmitting the force generated by the quadriceps muscle group to the patella. The patella is a small, triangular, round bone in the front of the joint. It acts as a fulcrum that increases leverage of the quadriceps muscles for increased power and also protects the front of the knee joint. There's also the patella tendon that's below the kneecap. This tendon extends from the inferior pole of the patella to the tibial tuberosity on the front of the tibia, or on top of the shin bone. It continues to the transmission of force from the quadriceps muscles via the patella to the tibia. The quadriceps mechanism term encompasses the quadriceps muscle group, quadriceps tendon, patella, and patella tendon. All of this works together to extend the knee joint. Finally, there's the tibial tuberosity and various ligaments, retinacula, and additional muscle tendons from that to insert the tibia called the pes anserine. The tibial tuberosity is essential for knee extension, and the ligaments and retinacula are very important for stabilizing the patella and maintaining its position, known as tracking during the knee movement. Okay, so now that I've given you a 101 on the anatomy of the knee extensor mechanism, let's get into some diagnoses that I commonly see given the extensor mechanism injuries. If any of these sound like something that you're struggling with, please give us our office a call. Oftentimes when athletes come into my office, they're struggling with injuries to their extensor mechanisms. One of the most common injuries is patellar tendonitis, or more accurately, tendinosis, or commonly known as jumper's knee. Essentially, this is an overuse injury characterized by inflammation, micro tears, and degeneration of the patella tendon, which connects the patella to the tibial tuberosity. Repetitive jumping, running, or activities that involve frequent bending and straightening of that knee can strain that patella tendon, resulting in a diagnosis of jumper's knee. If you're struggling with this, you're likely pretty active and experiencing pain just below your kneecap, especially during activities that load the tendon, such as jumping or squatting. Pain may worsen with that continued activity, but may also be present at rest in severe cases. Jumper's knee is pretty hard to treat, especially in many patients who want to return to activity as quick as possible. So regenerative medicine techniques like I offer here at NJRI provide promising alternatives to traditional treatments. The treatment for patellar tendinosis will depend on the severity, which can be evaluated in the office with ultrasound, which is more sensitive than an MRI. PRP, or platelet-rich plasma, can be used for degeneration of that tendon. Although it does respond to PRP, the patella tendon is a little more resistant compared to other tendons in the body. For this reason, if the tearing or degeneration is more severe, I would consider fat as a source for treatment. MFAT can fill that gap in the tendon, and I've seen better responses with less potential for a need of repeat treatment. The largest gaps I see are in patients who have continued knee pain in the front of that knee after they've had part of that tendon taken and used to repair their ACL tear. Stay tuned for the video in the next few weeks explaining this procedure in more in depth. I also offer shockwave, prolotherapy, percutaneous tenotomy, or a combination of these treatments. Runner's knee is another common injury I see in athletes. The more scientific term for this, though, is patellofemoral pain syndrome. This is a condition characterized by pain around or behind the patella, often aggravated by activities such as running, jumping, or prolonged sitting. Many athletes often present with dull, achy pain around or behind that kneecap during or after other activities, particularly with prolonged bending of the knee while sitting. We call this the movie theater sign. You can probably understand why. Overuse or poor mechanics, muscular imbalances, and structural issues may also contribute to this problem. These injuries can vary in severity and may require different treatment approaches, ranging from conservative measures from the classic RICE protocol, that's rest, ice, compression, and elevation, or probably a more contemporary term would be better, called MEAT protocol, which is movement, exercise, analgesia or pain control, and treatment. All these can happen before surgery, which is a more aggressive cases might need. Typically, I first send patients for this diagnosis to physical therapy for a functional movement screen because this most likely is a biomechanical issue. If you're worried about developing jumper's knee or runner's knee, a proper warm-up, stretching, conditioning, and biomechanical assessments can help athletes reduce the risk of developing these injuries related to the extensor mechanism of the knee. Besides these two athletic injuries, I also treat a lot of traumatic patellar injuries. These include quadriceps tendon and patellar tendon ruptures, patellar dislocations or subluxations, where it's only partially moving out of the area, and patellar fractures. The two types of tendon ruptures come from a sudden, forceful contraction of the quadriceps muscle or direct blows to the knee. Patellar dislocation or subluxation is often due to twisting or sudden changes in direction. The fracture usually occurs with a hard fall or collision directly on that kneecap. All these injuries require physical examination, functional tests, and imaging for a proper diagnosis. Visit us at NJRI in Parsippany, New Jersey, to get evaluated if you had any traumatic injury. Unfortunately, if the injury is severe, one usually needs surgery. But partial tears or associated injuries can be treated without surgery. You can also call my office to schedule a virtual visit if it's more convenient for you. If you're struggling with any of these problems we addressed in this video, it's important to see a professional as soon as possible. Early treatment is one of the largest contributors to positive outcomes. Whoever you are and whatever you're dealing with, all of us at NJR are wishing you a full recovery and many years of good health. So that's all for me today. Thanks for tuning in, and be sure to give our video a like if you enjoyed it. Also, subscribe, hit that bell notification so you won't miss anything in the future videos. We post videos usually on every Monday or Tuesday, and next week we'll be doing a video on ACL or MCL injuries. If you like NJRI and you want to follow us on social media, look at X, Instagram, or Facebook. All of these are pinned below in the comments. Thanks for your support, and have a great week.